Hello, hello. I'm coming on tonight to talk to you guys about PTSD, which is short for post-traumatic stress disorder. So PTSD is a term that's thrown around a lot, but there are very specific diagnostic criteria for it. And I talked with two different people today about PTSD, so I thought I would just take the opportunity to get on and explain that a little bit because there's a lot more to PTSD than meets the eye. So as I said, PTSD stands for post-traumatic stress disorder, which means that you've been exposed to some sort of traumatic situation, event, experience, whether you were involved in it or you witnessed it, and you have developed a stress disorder as a function of that experience. There are very specific symptoms, as I said, not going to run through those, but basically if you develop a disorder or stress disorder immediately after the event, that's what's known as acute stress disorder. And if it persists and sticks around for a while, then you may meet criteria for PTSD. So what's interesting about PTSD is that several people can be exposed to the same traumatic situation or event. Some of them develop PTSD and some of them don't. We're not exactly sure why, but a lot of it has to do with just brain anatomy, DNA, how they process information, and then a lot of it also has to do with upbringing and experiences. So when a traumatic event occurs, it's going to be more traumatic potentially to someone who's been through a lot of trauma in their life versus if it just happened in a vacuum. By the same token, if it's just a one-off sort of traumatic situation and someone doesn't have that history of having trauma and figuring out how to cope with it, it could be even more powerful for them. So there are lots of different treatments for PTSD, and that's probably a post for another day. But I just wanted to talk about a little bit about PTSD. So there are, as I said, specific symptom criteria that speak to things like flashbacks, nightmares, sort of re-experiencing symptoms. There are also some avoidance symptoms where maybe you avoid or stay away from or endure with great anxiety the situation or a similar situation to the one that was traumatic for you. So if you go online and you search PTSD DSM-5, that will give you the DSM-5 criteria for it if you're curious about that. The DSM-5 is the Diagnostic and Statistical Manual of Mental Disorders that we as psychologists use to diagnose patients after a clinical interview. So what I wanted to emphasize about PTSD is that it is an anxiety disorder by nature. So the treatment involves kind of two approaches. So there's the best treatment that we know of for trauma, which is prolonged exposure or desensitization therapy, where you continuously expose yourself to discussing, remembering, replaying, whatever it is, the traumatic event, and then you become desensitized to it. So it doesn't affect you as much. You can't forget it. We can't pluck it out with some sort of lobotomy, maybe, or without that, we can't get it out. So you have to learn to be desensitized to your reactions to that thing. So some of the prolonged exposure therapies include just journaling, talking, and then recording yourself talking through the event and playing that back. Or my favorite to use for that is EMDR, eye movement desensitization and reprocessing. And that basically, long story short, it takes this really intense traumatic experience that's stored deep in the recesses of your brain, brings it to the surface and stores it more diffusely so that it's not so impactful. Again, probably another post for another day, but the other thing about PTSD that a lot of people miss, a lot of practitioners miss in the treatment, is they do the prolonged exposure, they do that desensitization part, but they forget that PTSD as an anxiety disorder also needs treatment just on the daily in terms of coping skills to mitigate anxiety. So if you followed me for any length of time, you know I have posted tons of videos about anxiety and written about it and podcasted about it. But the long and short of it is the antidote for anxiety is control. So when someone has an anxiety disorder, whether that's PTSD, generalized anxiety disorder, a phobia, whatever it is, when someone comes in with anxiety, it's really important that they learn coping skills in the form of creating structure and predictability. So again, that control is the antidote for anxiety. And whatever you can do to work with your provider, or if you're doing self-care, self-help, then you want to find ways to control your environment. This doesn't mean go out and try to control everyone around you, but it means create some structure, maybe a schedule or some sort of predictability to mitigate your anxiety on a daily basis. So that will take the anxiety of PTSD down a notch, and then you do your prolonged exposure treatment, and that will help you with those memories and becoming desensitized to that. So if you guys have any questions about anxiety disorders, PTSD, if you want more information or you want me to do another video related to some of these topics or any other topic for that matter, you're welcome to leave a comment, or you can private message me and I will give it a go. Thanks.